Hey guys, I'm going to walk you through today how to do neuromodulator, specifically Xeomin, for this lovely patient of mine. He is a male, and so his injection treatment plan will be different than a female. So, first, we're going to start with that frontalis muscle, and I am just mapping out where I'm going to inject him. Notice that he does have really strong muscles, but his forehead is very small. So, this is actually a trickier patient because of those baseline heavier eyes, less surface area, but a strong muscle. Next, we're going to move on to the glabella. You can also see how strong his muscle is there. He pulls very laterally, so that's another thing making his glabella injections a little bit trickier. And then lastly, I'm also going to map out his crow's feet. This isn't an area that he typically does, but I recommended it because of his eyes being a little bit heavier at baseline. I really want to give him his depressor muscles more support while we put a lot of units in that frontalis muscle. Okay, guys, so we're going to start with the glabella injections. Make sure you clean the area off. And then, one thing to note, we talked about how his muscles are super strong. So, I'm actually going to be doing about 40 units in his glabella, which is more than the typical FDA recommended dose. But you have to think, how strong is the muscle? If the muscle is very strong, you're going to need more units to get a result that's going to last for that patient. So, technique wise, you can kind of see I'm going to have him squeeze his brows. I'm going to use one hand to pick up and support the orbital rim, and I'm going to use the other hand to inject nice and slow. You do this so that you have a less chance of any of that Botox seeping down and hitting the levator palpebrae muscle because we don't want to have an eyelid ptosis. Next, we'll move on to the procerus muscle. So I'll have him squeeze his brows again. You can see I'm injecting deep in this muscle, just like you inject deep in the medial corrugators. And then when you go to do the tail of the corrugator, you can see my mapped out markings where I know not to go past those. You are injecting superficial. So you should be able to see like a white little wheel to indicate that you are superficial and not deep, again, because we don't want to have any eyelid ptosis. Make sure you walk onto the other side of the patient when you're not injecting on your dominant side, because this way you're just more accurate. So again, you can see I'm going in, I'm putting my needle perpendicular instead of going in deeply, and I'm watching for that white bleb to indicate that I'm in a very superficial plane. And as you also go laterally, make sure you taper your dose. Now we'll move on to the frontalis injections. Again, I always have my patient animate, make sure my markings are right. And you can see I am starting above that line of convergence. And some things we talked about, his forehead is very, very strong, and he needs a lot of units because I want this to last him the appropriate amount of time. So while I'm doing a lot of units, I actually did 35 units total in his frontalis muscle. Again, FDA approved is up to like 20. I'm doing majority of those units above that line of convergence, and that is to help prevent him feeling heavy or any eyebrow drop. As we move on to below that line of convergence in the frontalis, you can see how my injection depth will change. I'm doing very superficial injections, and I'm putting my needle perpendicular. Again, when you're below that line of convergence, or if you're on the line of convergence, superficial injections, you should really see like a white little bleb. And you can see this with my needle versus when I was above that line, I could go deep on periosteum. So if you go deep on periosteum, that's recommended if you're up high, because that's how you're going to get those results that are long lasting. But if your patients have those lines that pull a lot closer to the eyebrow, super important to be very superficial and still don't get too close to the brow. I mean, you can see I'm still a good, finger breadth or so above his eyebrow, and I'm not going directly above it, because if you get too close to the brow, you still are going to run that risk of dropping the brow. So last but not least, we're going to treat his crow's feet, which is also the orbicularis oculi muscle. And like I said, he had not commonly done this area, but I suggested it with his anatomy because he has that smaller forehead, really strong forehead, and heavier eyes at his baseline. You want to do everything you can to help support the muscles that you're treating. So The forehead, remember, is an elevator, and so we want to treat the depressor muscles like the glabella and the orbicularis oculi so that that patient doesn't feel heavy when they get that neuromodulator treatment. So as far as units, we did 13 units per eye. FDA recommends 12, but again, this is a reminder, this is not cookie cutter. Each patient's different. Assess their anatomy, assess their muscle strength, and make good judgment. So as far as depth goes, you're going to be very superficial. Make sure that you're not going deep because you don't want to hit any zygomatic major or minor muscles and affect their smile. You should see a little wheel, and as you go around the orbicularis oculi, make sure you taper your dose. This will prevent any type of shelving or weirdness when they smile. I hope you guys enjoyed it, and we'll attach a video of him living his best life in Greece with a nice smooth forehead.